Good evening, everyone. My name is Kim Jones, and I'm the coordinator for Healthcare for All West Virginia. We, along with West Virginia Citizen Action Education Fund, West Virginians for Affordable Healthcare, West Virginia Center on Budget and Policy, and the League of Women Voters welcome you to the Healthcare for All campaign's Cabell County Health Candidate Forum. West Virginia Healthcare for All campaign has one overarching goal: working to win the right to qualify to quality, affordable healthcare for West Virginians. Since 1999, we've worked on bills that have improved the lives and health outcomes in our state. For instance, a bill that granted dental benefits to adult medical recipients, put a copay cap on insulin in West Virginia, and extended postpartum Medicaid coverage for from 2 months to 12 months. And we fought bills that would defund healthcare in the state. We got our questions by surveying folks all over the state to see what issues they felt affected their families. So we are happy to have you all with us. So let's get started. If everyone would mute their pages and turn off their video until it's your turn to speak, that would be awesome. And I'm really pleased to have Betty Barrett back with us this year, and her friend Janice Gossett from the League of Women Voters, and they'll be moderating the forum this evening. So I'm going to pass it to Betty.
Thank you, Kim. It's good to be here. Thank you for everybody who is attending this program. I will give you the rules for our question and answer session. All candidates for the West Virginia Senate Districts 5 and 6, and all candidates for House of Delegates Districts 22 through 28 have been invited. Not all have agreed to attend. 4 candidates present will be given the same questions and rotated in their order, presented alphabetically. There will be an opening statement, and you will be allowed 1.5 minutes each to answer, to give your information. Then you will be given some questions, questions Kim referred to, and you will have 2 minutes to answer those. And the closing statement will be 1 minute. Now, we have a system where we will hold up a yellow card when we are at 15 or 30 seconds, depending. And then we will hold up a red card when the time is up. So you will know visually when your time is up. And we ask that you observe the time limit, as we want to allow everybody equal time. If there is time, we will have questions from the audience, and there will be allowed 2 minutes to answer those questions. Now, my colleague, Jan Gossett, will introduce the candidates.
Delegate Sean Hornbuckle of District 25, you have 1.5 minutes.
Hey everyone, my name is Sean Hornbuckle. I currently represent the 16th district, which is most of Huntington. It's also Milton, Ona, Culloden, West Hamlin. However, I am running for the 25th district, which is now the center of Huntington. It is the South Side, Fairfield, Highline, and downtown, and a little bit of the West End. I am simply running again because we need more people with integrity at the state capitol. We've seen a lot of different issues that have come about these past year, and it's very unsettling. And most West Virginians do not want these atrocious policies. So I just want to make sure that I can do my part in making sure the people of Huntington and Cabell County can have better.
Layman.
Okay. Sorry, you all were muted when you were trying to introduce the next person. So I wasn't for sure if it was me, but anyway, it's okay. Hello, my name is Layman. I'm born and raised right here in Huntington, West Virginia. I've lived in District 24 pretty much my entire life. I'm running because I believe representation truly does matter. We need more folks that are going to work hard and put sweat equity into improving our state. I have a lot of different experiences. I've been in the service industry for almost a decade. I consider myself to be a person of the people, and I'm just like everybody else. So I want to be a positive voice, working together with fellow delegates to push our state forward.
Thank you, Layman. Sydney Swirl McElroy from District 26.
Thank you so much. My name is Sydney Mcelroy. I'm running for the 26th District of the House of Delegates. I was born and raised here in Huntington. I'm a mom. I'm a family doctor. I always like to tell people that I work in the hospital where I was born, which is a wonderful thing to be able to say. And I'm running for office because, first of all, I believe our representatives should be accessible. I believe that when you reach out with concerns, with questions, with ideas, that they should answer emails and phone calls or meet with you if you go to Charleston. And that is the representative that I intend to be. I also deeply believe in service to my community. The way in which I feel like I've served my community up until now has been as a physician. I spend most of my medical career now providing volunteer medical care down at Harmony House. And I am deeply aware of the inequalities in our healthcare system, how many people strive to get medical care and cannot receive it. I've seen it firsthand, and I'm eager to discuss it tonight and work in Charleston to find solutions. So thank you so much.
And Karen Nance of District 23.
I am, running because I believe that all of us are touched by the lives of children, and we need good health care for them. If they have a home they can thrive in, they're going to grow up and they're going to be good citizens, and that would impact us all. Not only do I care about the children, I care about the historic aspects of history and education. I have been on the school board for 4 years in the past, and I am deeply concerned about some of the education bills and these amendments that are going to impact our education. I care about housing. As I wanted with our historic preservation, we bought the historic Barnett Hospital, the Black Hospital in Huntington, and I originally was trying to get homeless housing in the building, but that grant fell through. So I care about people who need housing. I care about veterans. I had a lot of veterans in my family. So am I out of time?
Time is up. Yeah, time is up.
Thank you, Karen Nance.
Yes.
Ready for question 1. Am I muted?
No.
On September 13th, the West Virginia legislature rapidly passed policy to make abortion illegal with only very narrowly defined exemptions. While 1 in 8 West Virginia babies are born preterm, and 14% of pregnant West Virginians do not receive adequate prenatal care, and 1 in 4 West Virginia families live below the poverty line. What are your plans to expand funding and programs such as SNAP, TANF, and Medicaid that provide vital services to support infants, children, and families? Delegate Hornbuckle, you have 2 minutes to answer the question.
Awesome. Well, thank you, Betty, for that question. As we all know, September 13th was a horrible day. It was definitely a setback in our great state, not just for women, but for all West Virginians. And so I think the trick there, as far as being able to expand the Medicaid, Medicare dollars, is truly working in a bipartisan manner and presenting the supermajority, which now controls the legislature, with just the good, cold, hard facts of where we stand at right now, in hopes that we would be able to find some way to add more dollars, because we will explode some of those services naturally. And if we're not prepared for it, our state will go further in the hole. And so when you talk about a plan, currently right now, I'm in an environment that has 22 Democrats with 78 Republicans. And the way it's going, it's a numbers game, but I do feel confident to be able to work with hopefully some of these Southern legislatures. They have a lot of different commonalities with their natural demographics, with impoverished folks, that they would be open to some of these things and expanding some of those coverages.
Thank you, Delegate Hornbuckle. Candidate Layman, you have 2 minutes to answer the question.
Thank you all so much. As a newcomer to everything, my plan is, 1, to get elected, and then lean on Delegate Hornbuckle for advice on how best to advocate. Working in the I've worked with Branches Domestic Violence Shelter for the past 2 years in rapid rehousing. So I've had many clients use of TANF and WIC and other services. So I think trying to advocate to the best of my ability to convey the need and the wants and letting our West Virginians know that we see them, that we hear them, and that we'll be there to try to do our best to bring those services to them.
Thank you, candidate Layman. Candidate McElroy, you have 2 minutes.
Thank you so much. I want to say, first of all, in reference to the ban that was passed on September 13th, that I think it's important that we never give up fighting for our reproductive rights. It's sad to see those rights rolled back, but just like that happens, we can push them back forward. So we never give up fighting to regain autonomy over our own bodies and healthcare freedom. I think it's important that we continue to speak out for that, no matter what laws have been passed in the past. Moving forward, I think part of it is holding people accountable for what they say. If people say that they pass bans like this on what people can do with their bodies in the name of life, then let's talk about life. Let's talk about the lives of children in our state today, the lives of families, and the support they need in the form of expanded Medicaid. There's matching federal dollars when we expand Medicaid. That's fiscal responsibility in my book. And the other way to explain that is we already have a country with a form of universal health care, in the sense that it is the most inefficient, expensive way to access health care. If you're sick and you don't have insurance, you go to the emergency room. That's the worst possible way to take care of people. There's not only a better way to provide people with health care, but there's a more financially secure way that actually saves us money and improves our economy in the long run. So I think it's a lot about messaging. It's about standing up and talking about these things in a way that makes sense to everyone, and that also speaks to the issues that the people on the other side of the aisle say that they care about, which is life and happiness and taking care of families, and also fiscal responsibility. And expanding these programs, at the end of the day, that's exactly what it does.
Thank you, Dr. McElroy. Candidate Nance, you have 2 minutes to answer the question.
If we are fortunate enough to be able for the Democrats to take the majority, my first thing would be to give women the rights back that they had under Roe versus Wade. If not, as far as the health system and our children, and we do have CHIPs, but things are underfunded. You know, the Affordable Health Care Act would have been a very good thing. I was under it for a little while. I'm older now. I'm on Medicare. They also, need to do something about the fact that I don't have prescriptions and things. Between my husband and I, we're paying almost $600 between Part B and a supplement, and we don't even have prescriptions. So children also need to be expanded under that. It's not socialism. I know what socialism is. Public services are not socialism. And so we need to expand the Affordable Health Care Act under West Virginia law to take in more children, more families, and even in some cases, maybe find something that we can do for seniors that would cut their costs that they're having to pay now just to, to have the basic needs, because, Medicare is doesn't cover everything, and the others are expensive. So I think we need to work on that through what the Affordable Health Care Act that's already out there for West Virginia, on how we can manipulate it to help. But first and foremost, I'm not a defeatist. We haven't started yet. We may take over. We take over. I want women to have their rights back under Roe versus Wade.
Thank you, candidate Nance. Now we're on to question 2.
We have talked to many individuals across the state who feel they must turn down an opportunity for additional work or earn more money in order to not lose their vital Medicaid coverage. Other states are using federal dollars to address this Medicaid buy-in for lower income workers, funded with federal dollars. Would you support a West Virginia workforce development program that would allow low-income workers who hit the Medicaid cliff to continue Medicaid coverage through a Medicaid buy-in program? Candidate Nance, you have 2 minutes.
I am fully aware of the fact that we have too many people that are not getting what they need. And so if we can expand programs and pay for individuals They should not have to lose their opportunity to work. My biggest complaint is the people are not understanding that whenever somebody goes to work anymore, young people, if they're a single family, it doesn't matter if they're a two family, they have to pay out so much in childcare, they both can't work. If they did, they wouldn't be able to afford the childcare. At $10 an hour, they'll have 3 jobs and still not have 40 hours in to support a family on. And that includes their food and everything else that they need. So we really need to do something in order to pay for more childcare if we really want them back in the workforce. I think over the pandemic, a lot of people realized that, it was cheaper to stay home. They were only going to realize about $50 a week the way things were by the time they had childcare paid for. And I believe that's a huge obstacle. And healthcare, losing the healthcare if they go back. Those are reasons why young people or even older people who are taking care of their grandchildren, they won't go back to work. It's a matter of what they can afford.
Thank you, candidate Nance. Delegate Hornbuckle, you have 2 minutes.
Thank you, Jan, for the question. And so I would echo the sentiments of my colleague, Miss Future Delegate Karen Nance. She laid out a lot of different points that would actually support why I do support expanding this. We have to make sure, though, from a fiscal standpoint, that we're going to be able to do this. But I'm a person that has been affected by this, as my sister, who was, a kidney transplant recipient and has to battle through, figuring out what type of work would be able to suffice, for her lifestyle and things like that. We're not being able to go over that cliff because, she has a mountain of different type of surgery costs and medical care bills. And so this is definitely a real thing for a lot of West Virginians, and I would wholly support something like this.
Thank you, Delegate Hornbuckle. Candidate Layman, you have 2 minutes.
Thank you. I think this is a great question. As somebody who's worked in the service industry for a decade and didn't have insurance because it is not afforded for local businesses that have small amounts of employees of 100 or less for it to be affordable, I would absolutely support affordable health care for everyone. When it comes to this is the first time I think working at branches for the last 2 years and working at Harmony House that I've had the opportunity to have insurance. For so long, I didn't have it. I was asking my wife, what do we do? I don't, so definitely advocating for everybody to have affordable health care would be a top priority. Especially those in the service industry working through COVID. I can only imagine the fear that they had working and trying to earn a living wage and then not knowing if they got sick with COVID, if they were, if they could afford to go to the doctor. Working with fellow colleagues to understand the fiscal side of how we can put that into place would definitely be something that I would lean on. But I would definitely be an advocate for healthcare for everyone.
Thank you, Candidate Layman. Candidate Mcelroy, you have 2 minutes.
Thank you. I think this is exactly the kind of program that we need, and I would absolutely support. I think that a lot of people feel kind of disillusioned and disaffected and disconnected from the whole process of government and the idea that it can be a force for good because of exactly issues like this. It's like you're punished for succeeding and growing in your career and working too hard because all of a sudden you don't have Medicaid anymore. And then you're in that hole where private insurance is so incredibly expensive that you'd rather just not get it. And I know a lot of people who fall into that gap and who feel like, it's just one more trap. I work so hard and I get to this level and now I've lost healthcare coverage. And what am I supposed to do? So I think a program like this would absolutely be essential because at the end of the day, what I see are people who fall into that hole. And these are hardworking West Virginians who get to a point where they can't have Medicaid, they can't afford private insurance, they avoid medical care, they avoid preventive services, and people end up presenting to the hospital much sicker than they ever needed to be because they weren't able to access all the preventive health services that frankly are our right, are every individual's, not just West Virginians, not just Americans, every individual's right to health. And so I think absolutely this would be a great way to start. There's a lot more work to be done to get everyone covered. And it's unfortunate that we have to take kind of a patchwork approach instead of an overall universal healthcare approach. But I think this is exactly the kind of thing that the state can be proactive and do to help a lot of hardworking West Virginians.
Thank you, candidate McElroy.
Question number 3. In 2022, the West Virginia legislature proposed a bill which would have lowered the private insurance copay cap on insulin to $35 a month and add a copay cap of $100 on equipment, supplies, and devices. Congress passed a copay cap on insulin in the Inflation Reduction Act, but that only applies to Medicare recipients. Would you support a similar bill to ensure that West Virginians with private insurance can afford needed insulin and insulin supplies to save lives and reduce tragic and expensive diabetes complications? Candidate Layman, you have 2 minutes.
Absolutely. Everybody needs to be able to have affordable health care. So this is something that I would absolutely support. And again, leaning on and advocating for to the best of my abilities. Healthcare should be affordable to everyone. So it is definitely something that I would advocate for.
Thank you, Candidate Layman. Candidate McElroy, 2 minutes.
Thank you. Absolutely. It's always interesting to me when insulin was first synthetically synthesized back in the 1920s. It was actually free when it was first created in a lab in Toronto and given away. And it's sad to think that we've gotten to a point where now pharmaceutical companies can make so much money off of something that is absolutely necessary to keep some people alive. So yes, we absolutely need to cap those costs. We need to cap all prescription drug prices, but that's another issue. And I've seen firsthand the consequences. It comes to mind a patient that I took care of a long time ago that, don't worry, I won't share enough information for anyone to know who this is, who I saw exactly this play out, who had avoided preventive health care for so long because they couldn't afford the medications, they couldn't afford the appointments, knew that they needed insulin, couldn't get it. And by the time they were able to present for health care and receive any kind of care, I saw all of these catastrophic complications that can happen when you have untreated, unmanaged diabetes for so long. And this person suffered so much unnecessarily and had to go through so many more intensive healthcare procedures as a result of this. And all of it could have been prevented with an affordable medication that is absolutely necessary and life-sustaining. So I think this is the least we can do, is to make sure that insulin and diabetic supplies are affordable. This is the very beginning of what we need to do. Absolutely, I support that.
Thank you, Candidate Mac. Candidate Nance.
Diabetes. My father had it, and then I've got a very close friend that was a type 1 diabetes. And it destroys, and I think a lot of people don't understand how much it impacts the overall health of an individual. And we need to have it so they can afford it. We need to cap the insulin, and we need to cap the supplies, because if these individuals who are diabetic actually can get their medication and control their diabetes, they will live much longer. We won't have them in the hospital with a heart problem. We won't have them at the eye doctor going blind. Their kidneys will survive, and they will live a lot longer. My friend that is a type 1, his wife was a vet, so she's been able to get him help at the VA, which he probably wouldn't have been able to have. And he's into his 50s now, and if it wasn't for that, he probably would have been dead. We worry about him all the time. His eyesight's going already. His kidneys are really bad. And so, this just keeps costs down the line. I don't understand the rationality of keeping insulin away from people when it's going to cost the whole system, including, not just the healthcare system, the government system that pays for these things, much more money in the long run. Let's let them manage their diabetes and stay as healthy as possible.
Thank you, Candidate Nance. Candidate Hornbuckle, you have 2 minutes.
Yes, ma'am. Like everybody else on this call, we all know someone who has been affected by diabetes and the use of insulin. I just had this past summer an uncle of mine that passed. He had long-time diabetes and it led to dialysis, and he was there for a while and got a transplant, but it was just a complication of things. My sister, who some of you all know, it started with her as juvenile diabetes and then sort of ravaged her kidneys. And so this is a problem that we're dealing with, and it is unacceptable for the most developed country on the planet to have not figured this out, and simply because they refuse to, of greed. And so not only will I be an advocate to solve this problem, if you all are referring to, I believe it was Delegate Fleshour's bill, I think that's who it was. I might have even been a co-sponsor on that, or one of them, because there was different variations. But I will undoubtedly be a part of the movement to try to right this once and for all.
Thank you, candidate Hornbuckle. Now, question 4.
The federal government is taking steps to no longer broadly subsidize free COVID testing, vaccines, and treatment. The costs will transfer to patients via their premiums and out-of-pocket costs. Do you see a future role for local public health departments to ensure that working West Virginians can afford testing and vaccines? What would you propose to help ensure that West Virginians can afford appropriate courses of the treatment for COVID-19? Candidate McElroy, you have 2 minutes.
Thank you so much. Let me say that when I was a student and a resident, I got to rotate through working at the Cabell Huntington Health Department. And I've always told students and residents they should do that rotation. It was one of my favorite things to see all of the services that our health department provides. Now volunteering at Harmony House, I work very closely with the health department as we talk about vaccine clinics for flu shots and COVID vaccines and HIV testing. And a well-funded public health department doesn't just save individual lives, it improves the health of the whole community. And I think that's really important, not just when we talk about each of us as individuals thriving and being healthy, but how do we improve the health of our whole community and ensuring that our public health departments, that our county health departments are well funded. And I know we're going to talk about Amendment 2, so I won't get there yet, but ensuring that they have the resources they need to provide free testing and free vaccines is absolutely essential. The pandemic, I know that it's been declared over, but it isn't over. I can assure you, I'm still taking care of patients with COVID. People are still getting very sick from COVID. It is important that we continue to have access to free testing so that when we're positive, we can stay home and not infect anybody else. And we have the ability to find that out quickly for free and take appropriate measures. And it's important that everybody continue to have access to not just the COVID vaccine, but all of our vaccines. Again, these are life-saving measures that improve the health of our whole community. And this is the same when it comes to treating COVID. It cannot be, this is a life-threatening illness for many people. It cannot be a matter of how much money you make or how good your insurance is, whether or not you have access to life-saving treatments in the face of an unprecedented pandemic. So I think that well-funded health departments ensuring that programs, just like we talked about, stopping that Medicaid cliff, are exactly how we ensure that everybody has access to testing, vaccines, and treatment for COVID, because it isn't over, not yet.
Thank you, Candidate McElroy. Candidate Nance, you have 2 minutes.
Well, I don't think that the epidemic's over either. And I do feel that we keep the health of the entire community with vaccines in better shape. And COVID being one of the worst, we certainly need to continue to have that vaccine. It may go on for years in different forms. It affects so many parts of the body. There's a long COVID. We really don't even know how bad, it's going to get. We're going to find out it was in the future. So yes, we should get the COVID, and we should have the test so we can stay home and keep the community healthy when we're sick ourselves. We should really have vaccines free for everybody. So our health departments need better funding in order for us to be able to do it. If someone wants to get their shots at their doctor's office, that's one thing, but there should be a free place where people can go and get not just the COVID, but the flu vaccine and the pneumonia vaccine. My doctor wanted me to take a pneumonia, the new one that's out vaccine. My husband and I, we went over to the pharmacy. They told us it'd be $500 a piece. Well, We didn't get that shot. And I'm a firm believer because my husband is a polio survivor. And I took all of the vaccines that were available when I was a child. And this is why we need to be able to keep our community healthy. People don't remember, and I've done a lot of study, they don't remember what measles will do to you. They think that they don't need these child vaccines, but measles could leave you blind. So
Thank you, candidate Nance. Delegate Hornbuckle, you have 2 minutes.
Yes, and so as far as talking about the pandemic and COVID, I will always defer to Dr. Mcelroy as she has a certain level of expertise that can help us all in this. As far as a plan to make sure any type of cuts from the federal level that we're still able to provide for our most vulnerable West Virginians. One, I agree with that notion that we should be doing that. But number two, I would like to look at what we're spending as far as healthcare dollars as a state and what we get as a match. And for us to do more preventative healthcare initiatives and programming so that we would see a cost savings on what we're going to save the taxpayer. But all that money that we're saving, I would like to appropriate a bucket for those dollars to go into for certain programs like this to subsidize the eventual, I guess we would say the decreased funding for things such as COVID testing and all things about that deal with public health.
Thank you, Delegate Hornbuckle. Layman, you have 2 minutes.
Thank you. Absolutely. You know, over the past 2 years with COVID and being able to get vaccinations, being able to get testing, and for it to be free, we should absolutely try to continue that. Again, friends working in the service industry, particularly at Backyard, here in Huntington, I know Drew Hetzer was able to get free testing for his service workers working, and you know, that's just awesome to see. But we should absolutely try to, at a state level, make affordable health care for everyone. It shouldn't matter, you know, how much you make from the top down. You know, fortunately, I will be working with awesome people to lean on who have expertise like Dr. Mcelroy. I have had several conversations with her just to have better understanding. Also, you know, learning about other vaccines that will be needed for communities such as monkeypox, working with the health department and having good relations to ensure that no matter who you are in West Virginia, that you have access to healthcare is definitely a top priority.
Thank you, candidate Layman.
On to question 5. And let me remind the candidates that the yellow card means that you have 15 seconds to wrap up, and the red card is stop. And the 5th question is, in November, West Virginia voters will be asked to vote on Amendment 2 that proposes taking 27% of personal property taxes, which are currently protected in the Constitution for local and public services, including critical health services, and will give the state legislature control over those funds. What will be the costs to our communities if we have fewer funds to invest in our schools and local public services? And what is your position on Amendment 2? You have 2 minutes.
Absolutely. I am against Amendment 2. I think anyone in our state that values our public schools, our sheriff's department, EMS, fire, those types of items, this is not a good amendment for any of those things. As you say, 27% slash on that. We do not have the money to withstand that. Now, there has been talks about, oh, we'll be able to get through. We set aside money. Well, we didn't set aside money as a legislature in perpetuity. All right. There's still, COVID and Biden dollars that are floating around. And so there would be monies to replace it in year one, perhaps even year two. But going beyond that, there is no plan. And so I'm absolutely against Amendment 2 because I do value those things. And there's just no way that we should be doing that. The cost that we will bear as a society, first and foremost, is that public education system and not being able to educate our children. And if we're not able to do that, we all know what happens once they become adults and they're not functioning members of society.
Thank you, Candidate Hornbuckle. Candidate Layman, you have 2 minutes.
So I am also absolutely against Amendment 2. I went to a public forum 2 weeks ago. I was kind of shocked that there were very few people there learning about Amendment 2 and 4. I think that it would be awful if it passes. Working at Harmony House, I can only imagine the decrease in funds. It's also it's hard to get a sheriff to respond to a mental health call, but taking more funds away, it would hurt that. My mom being a former retired educator, I just can't see, I don't agree what it would do with public schools, libraries, parks and recreation, fairs and festivals and different things that our counties need. And to put those up against each other to advocate for funds, I just don't think is something that is fair and just. And so I'm definitely against Amendment 2. I think there definitely needs to be some more education out for the public. I know that public works or there are people that are advocating for it need to push it a little harder so the public gets better education for it.
Thank you, Candidate Layman. Candidate Mcelroy, you have 2 minutes.
Thank you. Everything that Sean and Allie said, I completely agree with. I think that Amendment 2, it's an incredibly dangerous amendment because it's sneaky. It sounds like a good thing. We want to cut your personal property taxes. And a lot of times people hear, oh, you want to cut my taxes? Great. I don't want to pay more taxes. And so they think it might be a good thing. And I think it's really important that we get the word out that what we're doing is saying all of these essential services in your community, we're never going to have enough money to provide them all. And they're going to compete against each other. And that's such a trick that I feel like the supermajority plays on us over and over again, telling us we don't have enough money for all these things. When we do, they're just taking money from these things and then making us compete for all these essential services that we need. We need to provide more for our public education, not less. Our schools are already struggling to do all that we've asked them to do. Our teachers are struggling to take care of children in the ways we've asked them to take care of children with the money that we're giving them now. It's still not enough. And so to take more from public education, when we talk about health services, we need more mental health services. We need more supportive services and counseling services in our school. And we can't get there if we're pulling more money out of schools, if we're pulling more money out of our EMS, out of our fire departments. This is absolutely dangerous to our communities. And I think it's really important that we get the word out to people that maybe you're saving a little bit in personal property taxes, but all you're going to lose in the form of community services will far outweigh that little bit of money that you might gain in taxes not paid. And I think they should be very concerned to trust the state legislature as it currently stands with taking control over those funds in a responsible way for all of us.
Thank you, Candidate McElroy. Candidate Nance, 2 minutes.
Know how I could talk just in 2 minutes. I could talk on this for an hour. So I will start to say what my impression is of that amendment. You've got 3 basic ways of funding: the personal property tax on boats and cars, your real estate, and your inventory. And I believe the reason they put the boats and cars on so they could get the inventory, because they knew people would like to drop their taxes. They're going to take away about 1/3 of the taxes that are collected. And then they're going to turn around and take 25 or better % of what's left and put it in the general fund. This will literally destroy public schools. They're already having to share the funding they have now with homeschool parents, and then they have to share it with the charter schools where they're being set up. So the education system, it'll be a disaster. And then we've got all the things at the courthouse. We've got, they'll have to close down ambulance stations. They'll have to close down the senior centers. They'll have to close down some of the libraries. Our parks won't be treated as well. So when they say this will bring people in, industry will come, business will come. No, it won't, because businesses look for amenities like parks and libraries. They look for a good school system. They look for infrastructure. They look for being able to call the police department and get somebody respond, or the emergency services. So the taxes, really, if you look at what they are looking for, are on the bottom of their list, because you can look at where they're going, and they're going to places that have these other things, even when the taxes are high. So yeah, that means 50 seconds. So I'll round it up, and I'll just say I have a lot of things I could say about this, but this amendment is a disaster, and we need to get it voted down.
Thank you, candidate Nancy. Appreciate that. On to question 6.
Health equality means closing the gaps between privileged populations and marginalized or vulnerable groups of people in West Virginia. Vulnerable population include women, people of color, people with a disability, immigrants, the elderly, people experiencing poverty, LGBTQ plus populations, and people without a high school diploma. A person's social identities and situations, including characteristics like their income, race, education, age, gender, sex, and sexuality, can influence rates of chronic disease and access to treatment. What do you think West Virginia can do to advance health equality and reduce health disparities? Delegate Hornbuckle, you have 2 minutes.
Awesome for that question. One thing that we are currently trying to do at the legislature, but we haven't done enough, and we haven't gotten a good piece of legislation across governor's desk yet, is making sure that we're able to help currently our nurses, doing some type of tax credit programs to get more nurses into our system. And so that is one thing that I think with having a more robust staffing that will help us as what I would call residents of the state. Number 2, all of those what I would call subset groups of populations, they are disadvantaged and do have lower rates of health attainment. But we have to do a better job. Certainly, we've taken strides with women, all right, and we need to do a lot better job with LGBTQ, but they're absolutely zero.
Go on to candidate Layman. You have 2 minutes.
So as a person within the LGBTQ plus community, and being treated unfairly, definitely advocating for better healthcare, passing the Fairness Act, just being seen as an equal West Virginian would be awesome. As the legislature currently stands, that does not look like it would happen. So I think, like I said in my opening, electing people that representation truly does matter. We need to have more voices of diversity in our state legislature to speak for LGBTQ, different minority groups, also working at Harmony House as their director of development, seeing how our homeless population is treated like less than, and they're our neighbors. We need to get back to treating and advocating for people like they're our neighbors. It should be neighbors helping neighbors. We should treat all people equally, no matter where they are, no matter how much money they make, no matter who they love. We're all people. So we need to get back to, at the legislature, advocating for our people as people and not what the party says.
Thank you, candidate Layman. Candidate Mcelroy, you have 2 minutes.
Thank you. As a family doctor, I'm much more of a clinician than a researcher, but I think when we talk about issues like this, it's important that we recognize that when it comes to, on a community level, on a public health level, you're not counted if you're not counted. And so part of what we need to do is to actually understand all of these different groups that exist within West Virginia. We need to collect proper data about our LGBTQ citizens, about our people of color, about people with disability. These people are often left out of healthcare conversations. There isn't a checkbox for them on the forms we fill out. And so in order to provide them adequate care, first of all, we have to recognize that all these groups exist and include them in our healthcare conversations, in our research, in our efforts to advocate for and create programs that outreach specifically to different minority groups. We actually have to include the needs of those minority groups, which means going out, talking to people, bringing them to the table, talking about social determinants of health. What kinds of challenges within our society are unique to these different populations? And all of that involves bringing diverse voices to the table and making sure that they are all recognized and that they're all included in these conversations. Only then can we know what they need and what they're lacking and what their barriers are. And then we can start providing for them. I did not provide as good care to people experiencing homelessness and people with substance use disorder until I started volunteering at Harmony House every day and finding out what their barriers to care were. And that's exactly what we need to do on a community level, on a county level, on a state level, is to go to those people, bring them to the table and find out what those needs are. And that's the only way we can serve them better.
Thank you, Candidate Mcelroy. Candidate Nance, you have 2 minutes.
Everyone is supposed to be equal, but the perception is that they're not. And we need to do something about changing that perception. All these other things we need to do too. We need to find out what they need. They are individual minorities. They have different needs and concerns. And so we need to go to them and we need to bring them out too into the community. When a long time ago, I sat on a tourism committee for West Virginia, and they said that African Americans would go through West Virginia, fill up in Kentucky so they didn't have to stop here. So what we thought was their faces should be in our welcome centers. So we should be able to start having minorities more involved in our West Virginia's faces that we show. And that might help people say to themselves, well, the perception that they are not equal or they are different is wrong. They are the same. But all these other things that we need to do that the others mentioned, we do need to do. We have to find out what's needed. I work a lot, if people know, in the African American community too, with historic preservation, trying to keep their footprints there and not let them disappear in the sand to where nobody knows they ever were here or they're in the past. So we will know that. But there's a lot of things we can do in order to bring them into the forefront, so the perception may change. But if it doesn't change, that's what laws are for. And we will keep trying to pass them to make sure their particular rights are actually protected by law and they're equal under the law. But then being equal in the minds of people is a little harder to get.
Thank you, Candidate Nance. Delegate Hornbuckle?
Is this the closing?
No, I was going to give you another minute on health disparity because we lost your connection.
Oh, thank you. Thank you so much. And so I was going to go piggyback off, right now, Marshall University, they have several programs that are geared towards disadvantaged communities and community of colors, to getting kids in at a young age into the healthcare profession. And so from a state perspective, we need to be looking at leaders like Marshall in that healthcare space, because that is also what is going to drive to decrease some of those gaps in healthcare disparities. There is, as you all very well know, there's a long history of the disparities between the African American community and physicians. And so there is that wall, there is that barrier there. And I do think if there was more education to the healthcare experts, but also recruiting more people into that field, I think we will see significant drops in that.
Thank you, Delegate Hornbuckle.
We've come to the end of our questions. There is time for questions from the audience. So if there's anybody in the audience who can get to the chat and put your question in there or to speak it, we would be very happy. We'll give you a couple of minutes to put your question in or get your question to us. So let us know if you have a question, and we will go through our candidates and give them each a couple of minutes.
Okay, the question was, keeping in mind the national children's health mental crisis, do you have any plans or ideas to try to address the mental health provider shortage in West Virginia?
Good question. We'll give each candidate 2 minutes to answer, and we will start with candidate Nance.
One of the problems, we have had in schools, and I will speak to that because I'm sure everybody will have a good perspective also, is that we have made an effort to bring in social workers. Our teachers and counselors are about education. That's what they went to school for. We do need social workers in order to work with the children so they can recognize issues that a child may have and get it some accommodations so it can reach its potential. Every child needs to reach its potential, and we need to help them get there. Also in our schools, we have a problem, with a counselor might know some programs, but a social worker, if a child has a particular problem at home, they know programs and where to go to get the help for the family or for the child if it's a particular issue with the family that the child needs. We have too many children that they're not being recognized that are having problems at home, which is affecting their mental health. And we need to be able to do that. We also need to do more with our police force. I believe in having social workers embedded in the police force. So when a call comes in where a person is having a meltdown, maybe that has a mental issue, that they come in, the police are not aware always of how to identify that particular problem. So they don't know how to address it. They might think that's just somebody drunk on the street acting out. But in reality, they may be having some kind of a mental breakdown because of something that happened because they have an issue. And we need to make that mental breakdowns and mental health not to be a stigma. It's not a stigma. It is a condition, and we need to help people who have those conditions in every way we can.
Thank you, candidate Nance. Candidate McElroy.
Thank you so much for this question. It's such a big multifactorial issue because we are dealing with multi-generational trauma in our state that our children have gone through related to the opioid crisis, substance use disorder. They're growing up in houses with, they're losing parents, with addiction, with incarceration. Obviously, we have a crisis of our foster care system. So a lot of children who have nowhere safe to go. So it's a big issue. And I think recognizing the size and scope of it and how much time and how much effort and how much money we need to address it is step one, because this is our future. And our children leave the state routinely because they don't see us addressing and fixing these problems. Part of it is ensuring that not only social workers, but more school-based counselors. We need more access points for these kids for free in schools where they can have somebody to check on them and talk to them and identify these issues early on. We need more resources within the community. It is so hard to get in with a counselor or a therapist or a psychiatrist. You got to move mountains to do that because we have so few. And then, of course, if you don't have the appropriate insurance that they take, then that's a whole other battle. But in order to draw more providers in these areas to our state, with social workers and counselors, we have to make sure we're paying them. And when it comes to, how do we draw, this is always a big question, how do you draw more physicians to the state? You have to have communities where people want to live. You have to be funding schools. You have to make sure that this is a community that supports everyone. And this is a place where I want my family to grow or I want to build my business, or I want to see my children thrive and where I think they'll want to stay. So it's a huge thing that we have to recognize and reckon with and put money and time and bipartisan efforts to address if we want to break this cycle of trauma and keep kids here, which I'm a parent. I have 2 kids. I want to keep them here.
Thank you, candidate McElroy. Candidate Layman, you have 2 minutes.
Kind of echoing what Dr. McElroy said. This is such a layered issue. Coming from being a part of the LGBTQ community, and knowing what our youth are going through in high schools, especially if you identify in the transgender community, and having free access to counselors, knowing who is safe to go talk to, especially when it comes to conversion therapy. Luckily, we live in Huntington, where we have kind of a safety bubble of having kind of our own little Fairness Act and conversion therapy band. So I think paying people appropriately to come to West Virginia, and want to stay here. And again, what we need to do is listen to the experts when it comes to presenting things like this into the legislature. My friend, Dr. Mcelroy here, listening to things that she has to say as a physician, and that's who we need to listen to, and advocating for everyone to have access, when it comes to like what Karen was saying, with police, and working at Harmony House and seeing people experience different types of healthcare issues and trauma and mental health. We just need to have access and healthcare for everyone, period, from all different age ranges. And that's what we'll advocate for at the legislature.
Thank you very much, Candidate Layman. Delegate Hornbuckle.
Thank you for the question. This is something that has been real big to me. I have a bill out there that I've run 2 years in a row now that deals with mental health. One, it was aiming to add more mental health professionals in our school system. Number two, which is the big part that I really liked, it was going to be able to provide wraparound services. And so they identify a child that has these issues. Not only do they work with the child, but they will work it out to be able to work with the parents or the guardians. A lot of times we forget you can help a child, but if you're not going to the root of the problem, which is usually at home, then your efforts will be met with a little bit of resistance. And so I think that is the way that we can do that. Also, when you do that, we are going to look at the expulsion and suspension rates, making sure that we're not just doing that to our kids because there is underlying issues. It's not always behavioral. And so if we do that, I think we'll be able to accomplish these goals.
Thank you, Delegate Hornbuckle. We appreciate it. That's the end of the first audience question. Are there any additional questions, Kim?
Nope, I don't think so, Betty.
All
If we
right.
want to
Then
go
we-
on to the last.
We are ready for the closing statements. As you know, this candidate forum is being hosted by the Healthcare for All West Virginia Coalition of Organizations, including West Virginians for Affordable Health Care, West Virginia Center on Budget and Policy, and West Virginia Citizen Action Education Fund, and the League of Women Voters of the Huntington area. The question that we'd like you to answer in a minute is a wrap-up question. What does healthcare for all mean to you? And what steps do you envision to expand access to quality, affordable, comprehensive healthcare for all West Virginians? And we will start with candidate Layman.
Well, thank you so much. One, I just want to say thank you all for inviting us to be here. It's great to have the opportunity to always speak and answer questions. I want to focus on priorities that unite us and not divide us. We need to move forward together, and hopefully, not hopefully, I'll be doing that with everybody that's on this call moving forward. So we'll get to listen to the expertise of Dr. Mcelroy and leaning on Sean with the experience, and we'll just pushing forward together. I think that it's healthcare is such a great need, and as somebody who was without it for about a decade, I'm definitely willing to advocate for the best of my abilities to make sure that it is accessible. As a person in the LGBTQ community, just making sure that we have it for everyone is a definite must.
Thank you, candidate Layman. Delegate Hornbuckle.
Yes. And so Healthcare for all, to me, is prosperity for all. We need to make sure that people are able to go to work, that they're not just sick, that they're able to do the daily things that it takes to raise a family. We need to make sure that not only do we have a healthy populace just for health, but that we'll have businesses that will want to relocate here because they know that the proper care is within an arm's length reach. And so this is something that I've always stood for, and I'm always looking for different opportunities. I don't have all the answers, but that is why I was with Delegate Barbara Fleshauer when she was running the insulin bill. That's why I will be with Dr. Mcelroy when she is sharing her expertise with the legislature. This is something, again, that's near and dear to me. And if we're able to figure this thing out, we will all experience a better West Virginia going forward.
Thank you, candidate Hornbuckle. And appropriately, Dr. Mcelroy, you get the last word. You have 1 minute.
Thank you so much for hosting this forum. This is such a obviously dear topic to my heart. I see the devastating consequences of not having healthcare access for all every single day. Medicine for me was as much a calling as a profession. So healthcare for all is what I get to do right now, which is I provide free healthcare to everybody who needs it at Harmony House. And my main concern is doing the right thing for them, taking the time they need and providing the services they need to the best of my ability without concerns for billing or payment. Now, we're not there as a country. That's a much bigger goal, obviously. And so in the meantime, I think that patchwork efforts like we're doing are what we have to approach. How can we stop people from falling over that Medicaid cliff? How can we ensure that people can afford all of their prescription medications? How can we close loops for children who are having difficulty accessing healthcare services? All of these different efforts to fill in those holes where they exist are the best we can do right now, knowing that our ultimate goal is that our tax dollars will go to a healthcare system that we can all access for preventive services, for emergency services, for surgeries, for acute issues, for whatever we need moving forward. That's the dream.
Thank you, Dr. Mcelroy. That ends my part of the program. I'm going to turn it back to Kim Jones.
Thank you so much, Betty and Jan. Wonderful job again. So glad to have you with us for our candidate forums. And thank you so much to the candidates. I really appreciated your answers, and I'm excited to see these plans move into action in West Virginia. This is the first, I wanted to do a little housekeeping. This is the first in 4 candidate forums being held across the state in the next month. Wood County is on October 4th. Monongalia is October 11th, and Kanawha is October 16th. And Kanawha is going to be an in-person forum, and it will be surrounding some of the issues that we've been talking about with health equity and social determinants of health. So we're really excited about that one. We have the registration links, I think, in the chat and information, or you could come visit us at Healthcare for All West Virginia's Facebook page. And finally, we just always want to end our candidate forums by saying, please vote. And here's some dates to remember in West Virginia. October 18th is the deadline to register to vote. October 26th through November 5th are early in-person voting. So make sure to bring your ID. November 2nd is the deadline to request an absentee ballot. And November 8th is election day. Polls will be open from 6:30 a.m. till 7:30 p.m. Bring your ID. And November 8th is also the deadline to mail in your ballots. So that information is also in the chat from the AARP West Virginia Voting Guide. And I just want to thank everyone for coming. Have a wonderful evening.